Just hours after Senate Republicans presented their new health care bill, it may already be in danger. Senator Rand Paul says at least 4 Republicans oppose it, including Senator Ted Cruz, who is working in the group there that developed the bill.
We cannot support the current bill. We're open to negotiation, but we want the bill to look more like a repeal. We're afraid that when we read the bill, that it actually looks like a reiteration or a keeping of Obamacare. As we estimate the costs of the subsidies to buy insurance, we actually believe that they may exceed or at least equal the subsidies that are in Obamacare. As we look at the expense of the bill, we actually believe in the first year or two that it may well cost more than Obamacare. And as we look at some of the things like a brand new federal program to pay insurance companies, a stabilization fund, we think that the idea that we're going to allow the death spiral of Obamacare to continue, but we're going to subsidize it, is just not a very Republican notion.
I have been clear from day one that I want to get to yes. When I ran for Senate, I campaigned on repealing Obamacare. It was the central promise of the campaign. In my time in the Senate, nobody has fought harder against Obamacare than I have. This matters. We've got to do it, but we also got to get it right. It's not enough just to pass a bill that has Obamacare repeal in the title. We've got to actually have legislation that fixes the underlying problem. You know, under Obamacare, the average family's premiums have risen over $5,000 a year. That is the fault of the federal government. It's the fault of the failed federal policy that is Obamacare. We need to fix that. And so throughout the conversations with the working group, with the majority leader, with the president, with the vice president, I've made very clear, I want to get to yes. And the way to get to yes is fix the underlying problems, lower premiums, and I will happily be part of it. We can get there, and I think there are a lot of other senators who feel very much the same as I do.
And in addition to Senators Paul and Cruz, Republican Senator Mike Lee of Utah, as well as Senator Ron Johnson of Wisconsin, say they'll also vote no. Senators Dean Heller and Susan Collins have also expressed concerns. Well, those comments, of course, are in addition to strong opposition from Democrats who say that the bill leaves more Americans without coverage in service of a tax cut for the rich. Former President Barack Obama has responded with a very long Facebook post, reading in part, and simply put, if there's a chance you might get sick, get old, or start a family, this bill will do you harm. And small tweaks over the course of the next couple of weeks, under the guise of making these bills easier to stomach, cannot change the fundamental meanness at the core of this legislation. The bill was also met with protests. Dozens of people have been arrested outside the office of Senate Majority Leader Mitch McConnell. The Senate plan does a lot of what the House plan did. It eliminates insurance mandates and Obamacare taxes. It cuts Medicaid, although more slowly than the actual House plan. And it cuts protections for people with pre-existing conditions, although not as deeply as the House plan. Republican leaders claim Obamacare is failing and that this is a step in the right direction. They want to vote on the bill by the July 4th recess.